Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with us is Dr. Khalil, who is a psychiatrist at Thunder Bay Regional Health Science Center in Thunder Bay, Ontario, Canada. Today we are going to talk about a mental disorder known as schizophrenia. Mental disorders are on rise not only in Canada but all over the world. Schizophrenia is quite a common disorder found in day-to-day life nowadays, and it has an effect not only on personal health but it has an effect on one's family life, social life and economic life. Hence it is very important to understand this disorder, how to diagnose it at early stage, how to treat it and how to prevent it. And Dr. Khalil is going to guide us about the same. Thank you, Dr. Khalil, for coming to the show again.
Thank you so much, and thanks for the invitation to come to talk about this very important topic.
I know you're very busy in your practice and we appreciate your time. Please tell us about mental disorder in general, how many patients you see every day in your practice, and especially about the schizophrenia.
Well, I work in a hospital setting and I manage inpatients at the Adult Mental Health Unit at the Thunder Bay Regional Health Science Center. And we manage patients with severe and enduring mental illnesses, and big proportion of patients who are admitted to hospital do suffer from psychotic disorders, and most commonly chronic schizophrenia. So it is a common condition that we come across, and it has huge implications not only on the individual, like you said, but also on their families and on the society in general. We manage patients on a daily basis who suffer from that condition.
So what is schizophrenia? Like, what does a patient present with? What are his signs and symptoms?
Well, schizophrenia is a mental disorder. It's a brain disease, and it's estimated that it affects about 1% of the population worldwide. So it is not an uncommon condition. So many people do suffer from schizophrenia, and it can be really challenging disorder, mainly characterized by the presence of what we call psychotic experiences. These can include delusions, hallucinations, but can also include other symptoms. It can cause real disruption to the patient's life in terms of their sense of self, sense of reality, their communication, their language skills, and also their relationships and their ability to manage activities of daily living.
So when you say delusion, hallucinations, can you please give us some examples, like how patient may present?
Well, delusions, first of all, I'd like to describe what delusions and hallucinations are. Delusions are firm beliefs maintained by the patient despite lack of evidence to support these beliefs, or evidence that's contrary to the belief. For example, the person may start to have some paranoid persecutory ideas that people are after him, or that or her, or that the patient may start to believe that there's an external power that's plotting against him or her. So even though that there's no evidence to support these beliefs, and it's not in keeping with the patient's background or reality, they still maintain to hold that belief.
They start believing and behaving like that.
Absolutely.
So that's a delusion. And how about hallucination then?
Hallucinations means that the individual has a perception of something that is not present. For example, they start to see, hear, or feel things that are not there. For example, the most common type of hallucinations, what we call the auditory hallucinations, which means hearing voices. So someone would start to hear voices coming from someone or somewhere that is not necessarily present and cannot be heard by other people.
Right. So they present first with the delusion or hallucination. What are the other symptoms?
Well, broadly speaking, the symptoms of schizophrenia can be broken down into three categories. The first category is what we call the positive symptoms, which you have identified, the delusions and the hallucinations. And these are common symptoms that patients with schizophrenia can present with. But there are also two other types of symptoms, what we call the negative symptoms and the cognitive symptoms. So the negative symptoms means that the person will have, or the patient will have reduced or diminished motivation or energy. they lack emotions.
They don't feel like doing the work, or they feel lazy?
Well, they feel more like they have no volition, no motivation to
do
initiate or participate in any activities, recreational or daily activities. So, and they also have reduced emotional expression. Their mood will be almost flattened.
Okay.
So these are the negative symptoms. The cognitive symptoms means that the patient will struggle with their concentration and their attention, which can also lead to impairment with their ability to function.
So can you explain more about cognitive, like how they will be able to identify the people, individual, or?
Well, but what's meant by cognitive, that it has, the illness itself has negative impact on their concentration and attention. So that will lead to disturbance with their ability to recall things or to focus or manage activities. So it will lead to impairment with their ability to manage daily living.
They will be able to identify the people around them?
That's different. That's like when it's not uncommon that when people suffer from schizophrenia, they have maybe reduced awareness about the illness, the impact that it has on them, and also the link between these symptoms and the presence of mental disorder. And we call that lack of insight or reduced insight. And that can cause some difficulties with them seeking help or support when it is required. And that's why patients with schizophrenia require regular encouragement and motivation to help them participate and engage with therapy.
So this positive symptoms, which is hallucination or delusions, negative symptoms like not ability to work or not feeling like working, and cognitive symptoms, when do they start? What age do they start?
Well, typically schizophrenia starts during adolescence or early adulthood, but there are some types of, or there's a type of schizophrenia that can start later in life, especially for females. So it can start at any age. However, it's more commonly in the early adult life.
Is it seen in children?
Very rarely.
Rarely.
It's more common that it is seen like with teenagers or young adults.
Okay. So who get the schizophrenia? Like what are the risk factors, or who is more prone to get the schizophrenia?
I mean, there is no clear kind of evidence to confirm one particular factor. It's still unknown. There have been multiple studies, lots of research to identify the reasons why people develop schizophrenia. And I think what is known now, that schizophrenia develops as a result of combination of different factors. For example, if there's family history of schizophrenia, that's what we call the genetic predisposition. That means that the individual is more, the family members are more likely to develop schizophrenia compared to the general population. So they are at increased risk. Other factors that can lead to the development of schizophrenia, for example, are pregnancy problems or exposure to toxins or drugs during pregnancy or to viruses. There's also some growing evidence to show that exposure to substances, including marijuana, during early life.
That can induce the schizophrenia?
Absolutely, and it is one of the contributing factors for the development of schizophrenia. There are some other conditions, genetic disorders, diseases within the immune system, autoimmune diseases can also lead to increased risk of schizophrenia.
Is there any structural abnormality in the brain for the patient who get the schizophrenia?
Well, certainly there are lots of kind of findings now from imaging studies and research that show that some portions of the brain don't function or are anatomically different compared to the normal individual. So the schizophrenia is a brain disease and it affects the brain, and there's growing evidence that shows that it's caused by deficits within these regions of the brain.
Thank you, Dr. Khalil. We'll take a short break and we'll continue our discussion.
Thank you so much.
Please stay back for the next part. Thank you. Welcome back to the show Talk with Your Doc. My name is Dr. Prashant Jani, and with us is Dr. Khalil, who is a psychiatrist at Thunderbird Regional, and we are talking about psychiatric disorder schizophrenia. Dr. Khalil, you were mentioning about various risk factors. You mentioned about the genetic or family history of schizophrenia, or pregnancy, or drugs like marijuana can cause, and there are some structural abnormalities in the brain of the patient with the schizophrenia. So how do you diagnose, or is it a clinical diagnosis, or you have to do some investigations?
Well, that varies from case to case, but generally speaking, the best way to diagnose schizophrenia is a clinical diagnosis. The Canadian Psychiatric Association recommends that the best way to diagnose schizophrenia is to rely on structured clinical interview and psychiatric evaluation. And that will involve gathering information from different sources. First, to meet with the patient and examine them, assess their mental state, any history of previous episodes, any history of drug problems, any physical health problems, or any other risk issues or concerns regarding their safety, for example, risk of suicide or self-harm. In addition to that, the health professional will try to gather information from families, from other people who've been closely involved with the patient, and also read the medical notes and medical records. But sometimes it is recommended to have some tests, for example, brain imaging or some genetic testing, but these are not an essential requirement. These are not essential requirements for the diagnosis of schizophrenia. It mainly relies on the clinical assessment.
So how does a family come to know that the family member is suffering schizophrenia? At what stage they should take them to the doctor? How does the family recognize them that somebody is suffering from that disorder?
Well, that's a very good question, and there is growing evidence showing that if schizophrenia is identified early and treated early, the outcome will be better. So early identification is essential. One of the early signs of schizophrenia that can be recognized for some individuals is that there will be some change with their social functioning. For example, there will be decline with their ability to function socially. There might be some change with their personality. They become more socially isolated and withdrawn. And occasionally they start to experience some unusual symptoms. Maybe not as severe like the full symptoms of delusions or hallucinations, but they can be experiencing some milder form of these like perceptual changes or thinking abnormalities. So whenever there is a suspicion, and if someone has family history of schizophrenia or early history of use of marijuana or some trauma during the early formative years, especially during pregnancy, it's important that they speak to a health professional, and they should speak with their doctor, because that way they can have more comprehensive assessment and review about the reasons why they have these symptoms. I mean, let's remember that these symptoms can happen with schizophrenia, but they are not unique to schizophrenia. They can be caused by other conditions. They can be caused by drugs, other physical health problems, other brain diseases. But as long as they can access support and assessment from health provider, that way they can receive care and treatment earlier than leaving it just late.
So if a family member notices similar symptoms, as you mentioned, withdrawn from the social circumstances, social gatherings, hallucination or delusion symptoms, do they take them to the family doctor or psychiatrist directly?
Well, the most important thing is that they should speak with their doctors first.
Family doctor.
So family doctor will be the first point of contact. If there are serious concerns about, for example, any safety issues, any risk of suicide or self-harm, or any other major concerns about their mental or their physical health, then certainly they need to see someone more urgently, and that may be through the emergency department. And if they have contact with the psychiatric team, then they can see their psychiatrist or their psychiatric nurse.
And then they might undergo some blood investigations or radiological investigations.
Absolutely, but most importantly is to have a thorough clinical evaluation.
Now, once somebody has a schizophrenia, one is labeled with the schizophrenia diagnosis, is it like a lifelong disease, or it can be cured?
Well, there's no specific treatment that can cure schizophrenia, and for most people it is a long-standing chronic condition.
It's a lifelong disease?
most people will suffer from schizophrenia for life. The guidelines recommend that when someone is diagnosed with schizophrenia, they should receive treatment as early as possible, and they should stay on the treatment. And schizophrenia is characterized by having a tendency to recur. So it's a remitting, relapsing illness. Well, that means that the individual is at risk of having the symptoms back again. So they can be at risk of relapse. And to prevent that from happening, remaining on treatment minimizes the risk of relapse. So for most people, it's important that they continue treatment in order to prevent relapse.
Does stress contribute to this relapse thing?
Certainly. I mean, stress is one of the factors that can lead to relapse.
Or the cause of the disease, probably.
It may precipitate the onset of the illness, but for most people, there are underlying predisposing factors that can cause them to develop. They are more susceptible to develop the illness, but stress is one of the non-factors that could lead to relapse, for sure. Relapse.
So one has to continue the treatment for whole lifetime, probably.
Well, as I've said, there are some patients who can recover from the illness, and I mean, whenever there is a kind of consideration for managing or reducing the treatment, that must be discussed with the health provider, with the psychiatrist, and it's generally recommended that patients stay on a maintenance therapy. That means that they stay on the medication for as long as they need it to stay well and to prevent relapse. However, there have been cases where they were able to stop the medication without experiencing any recurrence of their condition. But generally speaking, it's necessary to discuss this and ensure that this is agreed with the care provider.
So the treatment option includes the medications, so it's like tablets or drugs. Can you tell us about something about the treatment? What medications are given, how long they take it, and how do they take it?
Well, first of all, it's important to decide about the best setting for managing patient with, for example, first onset or first episode of schizophrenia. So usually this can be managed in hospital or it can be managed in the community, depending on the individual, their support network, and their willingness to engage with care and treatment. Once that's decided, then the mainstay treatment is medications, and we know that antipsychotic medications are effective to reduce the symptoms and to improve the quality of life. So all the symptoms that we've discussed, the delusions, the hallucinations, and some of the other symptoms can be helped with medications, especially during the acute early stage of the condition. And once there's resolution of the symptoms with medications, then other interventions can be provided, because at the early stage it's difficult for the individual to participate with other interventions. It's more...
The acute stage you have to treat with the medications, and admission to the hospital probably then.
That is sometimes required, and medications can be given as oral tablets, or they can be given as injection, what we call the long-acting depot injections, which can be given once every week, every 2 weeks, or even every 4 weeks, which can substitute the tablets. So the person will be less kind of concerned about when and how to comply with the treatment.
We'll take a short break and we'll continue the last part of the treatment.
Thank you so much.
Please stay back for the last part of the discussion. Thank you. Welcome back to the show Talk with Your Doc. We are talking with Dr. Samir Khalil, psychiatrist at Thunder Bay Regional Health Science Center, about schizophrenia. Dr. Khalil, you were mentioning about the treatment with medications. Do all the patients need medications, or is there any alternative option available for them?
Well, medications play a central role. They are essential for the control of the psychotic symptoms, particularly the positive psychotic symptoms. So all patients will need treatment. And the Canadian Psychiatric Association guidelines recommend that this must be used and must be continued for at least 18 months after the acute episode or acute phase, and then some discussion will be required to decide for how long the treatment will be needed. And as I've said, continuing the maintenance therapy reduces the risk of relapse. One of the important parts of managing schizophrenia is that the patient must play a big role in deciding what would be best for them.
Cooperation from the patient is very important.
Absolutely. So the patient must be offered information about the diagnosis, available treatments, risks of not having the treatment, and what are the potential risks of medications or other interventions. There are other treatment interventions that must be considered.
What are those options available?
For example, psychological therapy.
Psychological therapy.
And that would involve, the most common one is what we call cognitive behavioral therapy, or CBT, where the patient will meet with a trained therapist on a regular basis over a number of weeks. It can be done individually or in groups, and they will discuss the ways of controlling and managing the symptoms and the illness. So develop coping strategies, understand how the relationship works between feelings, behaviors, emotions, and the symptoms of schizophrenia.
Like a counseling, probably.
Absolutely.
Yeah.
But it's more structured, and it involves more discussion about strategies to manage the illness, how to ensure good compliance with treatment, how to prevent relapse, and how to develop the coping strategies to control the symptoms and the condition, and to reduce the stress, and to help the person learn ways to solve problems so that they reduce the risk of relapse.
So medications, counseling, or cognitive behavioral therapy or psychotherapy, how about the electrical stimulation? Does it help in treatment of schizophrenia?
What you mean, I believe, is electroconvulsive therapy,
electroconvulsive
or ECT.
therapy, yeah.
It's only used for very rare cases, for severely ill people with schizophrenia who have very serious health problems caused by their illness. However, being on treatment and having some medication or being involved with therapy really reduces the risk of reaching that stage or ending up requiring ECT.
Now, are the patients with schizophrenia violent or dangerous for the community or society at large or family?
Well, that's a common misconception. Unfortunately, that's how it's been portrayed in media sometimes, some of the movies, of course. But the risk of aggression, especially like for strangers, it's really comparable to the general population. They are not at increased risk. I would say that there are more serious consequences of not treating schizophrenia than aggression. If schizophrenia is not managed, there is risk of social withdrawal, decline with social functioning, drug use, because some people use drugs to maintain or to control their symptoms, which is very unfortunate. And also some further substantial decline with their mental health. So the risk of aggression and violence is very low, and it's more, the burden of the illness falls more on the individual. So that's what we have to remember, and it's important that they receive the right treatment, and there are many ways to help them to have more productive life and to integrate into society and to reduce all the consequences that I have described just right now.
So if they think that drugs are going to help them, actually drugs are going to worsen their schizophrenia.
Absolutely, and there's a lot of evidence that's showing that patients with schizophrenia are more susceptible to have more recurrences and relapses when they use drugs, even if they are compliant with their treatment.
Drugs, when I say it's not medication, drug means marijuana or...
Absolutely, or alcohol or any other illicit substances.
Now, what about the family members, social life of the family members? If somebody is suffering from schizophrenia in the family, how the family can cope up with that problem?
Well, that's very important, because many people, as I've said, they go to hospital, they're admitted for a period of treatment and stabilization, and then they leave and they go back to their families, and the family will have to share the burden of the illness. So family education, explaining to them about the condition, diagnosis, what are the signs of early warning signs of relapse, how to help reduce the stress, improve compliance with treatment. All of that can be achieved through education to the family. And we call that family therapy, where all family members are involved in some counseling session to discuss about the condition and how to watch for any signs of deterioration and how to support the patient.
So, quick question, what are the early signs of relapse?
Early signs of relapse, it varies and from one person to the other, depends on the individual. Some people may experience some mood changes, problems with sleeping, concentration or attention problems, decline with their self-care, or sometimes they experience the positive symptoms like the delusions and hallucinations back again. As early as possible, they must see their doctor or their nurse in order to get the right treatment before it escalates.
So how can one prevent getting schizophrenia altogether?
Well, that's a very difficult question to answer, and I know that there's a lot of research going into that direction, but I believe that it's still at the early stages. I think the most important thing is that when patient is suspected to have schizophrenia, they need to access help or support as early as possible, because, as I've said, that can lead to a better outlook and improved ability to function. Because with treatment, their lives could improve, their quality of life could be better, they can integrate into society, they can have better progress with their academic performance, with their work, with their relationships. So I think the prevention is probably going to be mostly focusing on preventing the illness from becoming
so yoga, meditation, or a peaceful life may be really helpful in this cases to prevent these disorders from.
Well, certainly to help reduce the stress, but also there are multiple agencies and support networks that are available. There are support groups for families, there are peer support groups for patients who suffer from psychosis, and now they can teach other patients how to manage and treat their conditions. There are also many organizations like the Canadian Mental Health Association. There are mental health teams, outpatient programs, including the city and Thunder Bay. We have the St. Joseph Care Group. We also have the Thunder Bay Regional Health Science Center, and both organizations have big psychiatry program. And we also have service which is provided by the Canadian Mental Health Association called the First Place Service that is responsible for monitoring and treating people with early onset or first episode of psychosis. So the general advice is that people must be informed, there should be more public awareness, they should know that there are many ways to help people with schizophrenia to achieve more productive life, and there are multiple organizations with doors open for them to seek help and support whenever needed.
Yeah, so take the help as soon as possible.
Absolutely.
Thank you, Dr. Khalil, for coming to the show.
Thank you so much for inviting me.
Thank you, everyone, for being part of the show.